Hello and welcome to COVID-19 Local Impact on Your TV. I'm Dan Malta from the Your TV studios in Peterborough. The confirmed cases of COVID-19 reported on the Peterborough Public Health Unit website decreased by 2 from 86 to 84 this past weekend as a result of a lab error at Biotest Labs in Ottawa. Peterborough Public Health was notified on Friday, May 1st, that a technical error occurred, and as a result, all COVID-19 positive tests reported from the 25th of April to the 26th have been rejected. Peterborough Public Health has been significantly impacted by this lab event, says Dr. Rosanna Salvatera, Chief Medical Officer of Health in Peterborough. Our staff has worked swiftly to ensure those impacted are informed and retested, as we want to resolve this as quickly as possible. Public Health Ontario is aware of the situation and has discontinued sending any more specimens to Biotest Labs for COVID testing for the time being. We'll also add 2 of the confirmed cases in Peterborough are from associates at the Shamong Road Walmart. Representatives say the employees last worked on April 21st and have been in self-isolation since then. The same goes for all co-workers who may have been in direct contact with the infected. We'll now get you the numbers from Kawartha Lakes. And in the city of Kawartha Lakes, it's 139 confirmed cases, 8 hospitalizations, 103 resolved cases, 32 confirmed deaths, 28 in long-term care homes as part of 3 confirmed outbreaks, and in Northumberland, status quo, 13 cases, 13 resolved. 1 of those was a hospitalization. Closures of city facilities and allowing residents to defer payments of property taxes during the pandemic will have an impact on the Peterborough city budget. Now, Mayor Diane Therrien says the city will be receiving a preliminary financial report next Monday.
Our Commissioner of Financial and Corporate Services has been working with the various departments across the city to put together a report. So that is going to come to General Committee next week. Via our online meeting. So they've been compiling as many numbers as they can in terms of the impact that the closure of facilities has had on the city. So, we didn't have ice rinks open for the last couple of months. There's potential impacts going forward in terms of not collecting fees for, say, like slow pitch and those types of activities that generally start in May or June. It's also going to be looking at the impacts of the property tax deferrals, how many households took advantage of that program, what that impact's going to be. And again, it's still quite preliminary, and I know they've been working really hard to try to pull from all the different departments. Transit is still operating, but we're not actively collecting fares. So there's a whole bunch of different impacts that the COVID's going to have on our budget, and that's, again, not something that's unique to Peterborough. Municipalities across Ontario are dealing with that, and so it's going to be a struggle going forward for sure, because this is also normally the time of year where normally in June we have our public budget meeting for the 2021 budget. So staff are also trying to prepare the budget for next year, and we're also dealing with these impacts. So it's going to be a challenge for sure.
Certainly a lot to consider for City Council going forward. The Haliburton-Kawartha Pine Ridge Medical Officer of Health, Dr. Lynn Noseworthy, tells Your TV many staff at the health unit are taking on new roles during the pandemic.
Well, we have reallocated staff to a few broad areas, and they include what's called case and contact management. So if someone is diagnosed with a case of COVID-19, health unit staff follow up with that individual and take a full history to determine where the person might have been in the 48 hours before they became ill, or before they had the test done for those few people who have no symptoms whatsoever. And then they identify people they may have been in close contact with, and then we do case contact follow-up with those individuals. We then contact those individuals every single day for 14 days to see how they're doing, to make sure that everything was going along fine. And if they develop symptoms, if they're a contact, to help them get assessed to determine if in fact they might have COVID-19, and to ensure that if they need supports, because they may be a single parent, they may have young children, they may need help in acquiring food or some other necessities of life, and to help work with them to solution how to get those sorts of support. So that's one thing that we've reallocated staff to. We've also reallocated staff to work in our call center. And over the past 7 or 8 weeks, we've received thousands of phone calls, as you can appreciate, The nature of the situation is that it's evolving, and we've tried to provide our staff who are answering the call center calls with the most current information that the province is providing to us and that we gather from other sources, as well as our own data. We also have staff who are continuing to do their regular work because we have restaurants to inspect that are providing delivery or pickup services or takeout services. We also deal with issues related to safe water. So people are getting their water tested and they may have questions, so we deal with them virtually. We also have reduced our staffing in our Healthy Babies, Healthy Children program because they've been reallocated to other program areas, but we do have a small number of staff who deal with our most high needs new families. And we have reallocated a lot of our staff who worked in the school system because the schools are closed. And so we periodically are doing some work with our school leaders when they're trying to problem solve around situations that they face. We've also reallocated a lot of our staff to the communication side of our response, and that includes dealing with the media like yourself, posting information on our website. We have a huge amount of great information on our website that's updated on a regular basis. We reach out to our healthcare sector on a regular basis, which includes our hospitals, long-term care homes, our physicians. We're reaching out to our municipalities. We participate in emergency operations center meetings that work with our community emergency management coordinators, and talking to other health units as well. So we're very busy liaising with other entities and providing information.
Staying in Northumberland, Community Care Northumberland Executive Director Trish Baird tells Your TV's Mark Rockburn, with many of the organization's programs run by volunteers, staff is stepping in to fill voids for the Meals on Wheels program and other initiatives.
In our Meals on Wheels program, we are delivering frozen Meals on Wheels. We are not doing hot Meals on Wheels anymore, but we are doing the frozen Meals on Wheels weekly deliveries, and we deliver the meals to the patient, to the client's front porch. And then we make sure that they know we're there and they take the meal and take it inside. So just over the 5 weeks since the pandemic has started, we average about just over 800 meals a week that we're delivering to clients across Northumberland County. Looking at our numbers from last year, it's about 35% increase. So for us, that's great, and it means we're getting those meals to people. We're also doing essential transportation, so that would be to essential medical appointments such as dialysis and chemotherapy, people that have specialist appointments that haven't been able to cancel. So we're doing about 85 trips a week to people. We have about 40 clients that we take on dialysis 3 times a week, so those are essential services. And our drivers are practicing physical distancing, cleaning the vehicles, that type of thing to keep everybody safe. And then most of the rest of our work is done over the phone and virtually through things like Zoom. So we're doing client visits over the phone. In our hospice services program, they're doing some support groups over Zoom. They had a volunteer book club last week over Zoom. So we're trying to keep everybody engaged in the services. We're doing a lot of phone calls, reassurance checks, those types of things. We are receiving new clients. So every day we have new people coming on service. And then, on a case-by-case basis, if people need help getting some groceries or prescription drugs, if they're in isolation. So we're just really reaching out and making sure our clients are supported and, relieving some of the anxiety.
Obviously, one of the biggest things that you did touch back on is the Meals on Wheels program. Have you seen an increase on that, or is that still just the steady clients that have always been registered with that program since now that we're in a situation that we are with COVID-19?
Yeah, we have seen a number of clients come on new to that service, but also it's the amount of meals that they're taking. So we are able to ramp that up so that they are increasing the numbers. A lot of our clients receive the hot meals, and it might have been 1 or 2 times a week, but now because they're not able to get out, they can receive 5 days a week, and we just organize our staff to deliver those meals. So certainly an increase in that.
In his daily address, Ontario Premier Doug Ford says it's status quo in Ontario for the time being.
We're moving in the right direction, and we need to keep going. And we can't stop now. We must stay strong. Our hospitals have capacity, our team is stockpiling PPE, and our testing strategy has allowed us to stay ahead of this virus. Because the sooner we can detect COVID-19, the sooner we can stop the spread and protect others from the infection. A few weeks ago, on April the 10th, I stood at this podium and promised you that we were going to ramp up our testing. We set a target of 16,000 tests per day by May the 6th. And thanks to our incredible team, thanks to the hard-working folks in our health system, we beat that target. And just over 20 days later, by May the 1st, we hit 17,000 tests a day. The good news is we're leading the country in daily testing volumes, both in total tests and per capita. Over 342,000 tests have been completed in Ontario to date. These gains are significant, but we still have a lot of work to do. We will not rest on our laurels. That's why we remain laser focused on ensuring we're testing our most vulnerable. We rapidly increased testing in our long-term care homes. We're testing those in group homes, homeless shelters, women's shelters, and other congregate settings. And as the key trends head in the right direction and the health system continue to be strengthened, it gives us confidence. It gives us the confidence that we can adapt. It gives us the confidence that we can reopen more places safely, knowing our health professionals have our backs. It gives us the confidence that we're getting close to opening parks, that we're getting close to opening retail for curbside pickup. It gives us the confidence that we're on the right track, that collectively, as a province, we're doing the right things and we're taking the right steps, that we're beating this terrible, terrible virus. And it tells us that we can't stop now. We need to continue looking out for each other. We need to keep taking the health advice seriously. We need to stay vigilant, and if we do, if we stay the course, we will defeat this virus. We can and we will. Thank you, and God bless the people of Ontario.
Prime Minister Justin Trudeau also spoke today. He announced that Canada pledges $850 million to research and find a vaccine for the coronavirus, both at home and abroad.
To keep Canadians safe and restart our economy, we need to defeat this virus not just within our borders, but wherever it will be found. That's how we'll beat COVID-19 for good. So just like we're coordinating our efforts across the country, we're collaborating with allies around the globe, too. Earlier this morning, I joined leaders from other countries and from civil society and industry to work together on accelerating the global development of COVID-19 vaccines, treatments, and testing. We all share a common goal, ending this pandemic, and Canada is stepping up to do its part. Canada's contribution of over $850 million for the global fight against COVID-19 includes investments in Canadian and international research. At home, we're providing funding for everything from the University of Saskatchewan's Vaccine and Infectious Disease Organization for their work on vaccine development to Vancouver-based Abcelera for treatments. Right across the country, we're making sure that Canadians can keep leading. Our $850 million commitment also includes support for vaccine development through the Coalition for Epidemic Preparedness Innovations and the WHO's Solidarity Trial that helps hospitals share information on treatments. The more we cooperate, the more likely that we find a cure and find it quickly. And that's something we all want to see.
As COVID-19 local impact continues, we'll hear from Jack Veach, the Manager of Community Engagement and Education for the Haliburton, Kawartha and Pine Ridge branch of the Canadian Mental Health Association, as he gives us details on Canadian Mental Health Week. Welcome back to COVID-19 Local Impact on your TV. I'm Dan Malta. Today marks the beginning of Mental Health Week in Canada, and it's safe to say mental health support will be integral as the nation works back to normalcy. We hear from Jack Veach, the Manager of Community Engagement and Education for the Canadian Mental Health Association's Haliburton, Kawartha, Pine Ridge branch, as he provides details about the virtual support being offered for Mental Health Week.
So this week is this is our probably the most prominent week we have as mental health professionals. We're able to support people with their mental health and wellness. We're able to promote a lot of mental health matters initiatives. So we're just super excited to be hitting the ground running in a brand new way, because this is the most unique mental health week I've ever been a part of.
Part of the uniqueness, skewed mental health statistics as Canadians feel the pressure of an adjusted day-to-day life.
And when we talk about sort of the general stats we always sort of kick around, we know sort of 1 in 5 will experience mental health concerns in a year, 1 in 3 in a lifetime. And there's actually some new data we've just released today from our national office. 70% of Canadians, or Ontarians I should say, 70% are experiencing some form of anxiety as a result of this increased feelings of isolation. So I mean, you're bang on. This is probably the most important week for us to get out there and let people know about the services that are available to them, just in a different way.
The different way, a virtual mental health week that can be accessed through social media accounts and the CMHA website.
So all throughout the week, we're releasing different sort of videos and blogs and posts, including our sort of blogs written by our health reporter, Tanya Kolenko, who does some fantastic work. We have Andrew Jones from Health at Work doing some yoga for us digitally. We'll have some Facebook Live videos on Friday. I'll be posting a video on Thursday of how to help or support a loved one. So all tips and techniques that we can use to support ourselves and each other, just delivered in a different way.
A question for Veach, as we hopefully near the end of the COVID-19 pandemic, what will a return to normal life look like for those suffering with mental illness?
We talked about sort of health professionals and health care have been talking about this as sort of in phases, and sort of what they're calling their predicted 4th phase is once we do start to come out of this, is that sort of that rash of sort of mental health sort of concerns are going to come to the forefront, that people can start to focus on, oh my goodness, yeah, things are getting back to that quote unquote new normal, but now I've got feelings of stress or strain or trauma that I've experienced as a result. What can I do to be well? And again, whenever I talk about sort of things I can do to take care of mental health, I always remind people, you know, it doesn't always have to be intensive psychotherapy or a dedicated medication regime, and it may be, those things may be really important for me to be or stay well, but the really simple lifestyle things I can do to take care of my mental health are just as important. And again, it is things like sleep. It's things like diet and being mindful of what I'm eating, things like caffeine intake and sugars, being mindful of exercise. And again, exercise is different. I can't head down to the gym because they're all shut down, but what can I do? Can I go for a walk? Can I go for a run? Can I go outside? Getting sunlight, man, the little bit. And again, we had sun on the weekend. I don't know if you got to enjoy it like I did, but that little bit of sunlight is going to help my brain. It actually helps, it gives us some vitamin D, which helps the synapses in our brain form and fire. Those little lifestyle things, they're going to impact your mental health immensely.
Lastly, a reminder, social distancing isn't a sentence to loneliness.
And I feel like I've been shouting, this is like my new catchphrase, is that social distancing doesn't have to mean social isolation. And using, like, look what we're doing right now. We're having a conversation using technology, face-to-face, more or less. And what are different ways I can still connect? Can I make a phone call? Can I do FaceTime? Or can I do Skype or whatever it's going to be? Can I connect with people much the same? That social connection, that peer-to-peer connection, that sense of purpose, that is going to be so important to taking care of health and wellness. And whatever I can do to have that little bit of social connection, again, safely and in a healthy, responsible way, we're 100% supporting that at CMHA.
As Jack mentioned, the CMHA social media feeds and websites have all the information you'll need to participate in Canadian Mental Health Week. To keep students' minds fresh while schools are closed, they're introducing eLearning. Trent Talks gives us some ideas on how to cope if your child is struggling with the new e-learning environment at home.
Different students thrive in different learning environments. So what are some strategies that can be implemented for students, particularly those who might be struggling with the e-learning format?
Great question. First of all, there's many types of e-learning, so maybe I should just spend a minute talking about those. There's remote learning, which usually involves transferring learning from an in-person sort of classroom environment to a distance model. The learning was intended to be in person, but now it's been converted. So tasks via email or Zoom, those kinds of things are happening there. There's home learning, which is about integrated learning at home with limited support from external people, such as teachers. And there's online learning. Online learning usually refers to learning that's intended to be offered in an online platform, such as Blackboard or Google Classroom, and it's a bit more sophisticated in its approach. Any of these could be at play for children in Ontario at this time. So, to the question, what do you do when your child or student doesn't really thrive in an e-learning environment? I'd say two things about that. The first is you can try to minimize the online time by downloading files and printing if you have that capability in your home. And as Denise said, that may not be possible. You can encourage handwriting in notes and setting very clear and short parameters around the computer-based learning time. So 30 minutes here, 30 minutes there. And the second thing is to acknowledge that this is just part of the day. Children and youth are natural learners. They'll be learning throughout the day. It doesn't all take place with headphones and a screen or a worksheet.
Everybody has to figure out what's going to work best for them. One thing I would say is let's take the pressure off. The idea here is not that parents or caregivers are suddenly the teacher and expected to follow the entire Ontario curriculum. The expectation is that some learning is happening. And so if you've got kids with really, really different ages or abilities, then I would say try to find some work that's going to satisfy each of them individually and some things that they can do together that might not be perfectly curricular for their particular level, but will still foster some learning at home. And people are experimenting with schedules. Some people have a really strict schedule. We're expecting our kids to do a lot of outdoor learning in the mornings and then some more structured sort of reading and math and that kind of thing in the afternoon. And so I can imagine parents with students at different levels would be thinking about, I'll assign this book for you, but on the schedule, it's reading time, something like that.
Yeah, I think it's really important to find that balance at home. It's huge. So again, some parents I've spoken to, like Denise, so the morning's going to be our school learning, and our afternoon is activity time, outdoors with a magnifying glass, making a mud kitchen, going out on a bike ride, painting rocks, helping with the gardening, doing an experiment or something along that line.
With summer around the corner, many people enjoy performances at Fourth Line Theatre just outside of Millbrook. Due to the COVID-19 pandemic, the first show of the season, The Great Shadow, written by Alex Poch-Golden, has been postponed to next summer. Mary Tendeshat speaks with Fourth Line's Managing Artistic Director, Kim Blackwell, who says the arts and artists are being impacted.
It's interesting for us in art, basically 99% of the people that I know are unemployed. Just like that, just overnight, not working. All theater actors, basically unemployed, technicians, and with no notice. It just happened like that. With the first show now having been postponed till 2021, the ramifications affect probably 30 to 40 people.
Because the first show has had to be postponed until 2021, what effect will this have financially on Fourth Line Theatre?
It's a good question that keeps me up at night. In the summer, we have 8 weeks to make 45% of our revenue. So if we don't get any kind of summer in, it will mean profound changes in the theater for several, if not up to 5 or more years to come. We are quickly, and have had meetings already about what a COVID-19 safe season could look like. So we've created a document which we're presenting to the provincial government very, very soon for both audience and our acting company and technicians and the people who work there. How could we keep everyone safe and potentially have some version of a season?
Fourth Line has speaker series every once in a while, and those are still continuing. In what capacity are they continuing?
So I usually do 1 or 2 in the winter at the Peterborough Museum and Archives, and then I do them at the farm as part of a Festival Fridays talks. And they're really well subscribed to at the farm under the white tent in that beautiful venue that we have. And we wanted to try to keep doing work. So we came up with this idea of doing a series of talks that I actually wanted to do for years as a podcast, sitting down with sort of the most important women in Canadian theatre as part of our Epic Women's Directing project. And so it came out of an idea that we just have never had time to do. And so decided, well, why don't we try it on Tuesdays in May and see what it's like? And I'm thrilled that all 4 of the women that I asked said yes. So Gillian Kiley is the Artistic Director of the National Arts Centre English Language Theatre. Then we have Judith Thompson, who actually wrote a play for Fourth Line. She wrote a play called Who Killed Snow White, but she is a renowned Canadian theatre writer and director and film writer as well. Then Nancy Polk, who is one of the founders of Soul Pepper and a renowned actress and director. And we're going to finish the series with Fiona Reid, who is a much beloved theater and film actress. She was actually, for people of a certain age, they'll know her as Kathy King, Al Waxman's wife on King of Kensington. That was one of her first jobs out of theater school. I hope for some light at the end of the tunnel soon, and I hope that in some way, shape, or form in the not too distant future, we can welcome people back to the farm safely.
Before we go, one last note. Starting today, Vinnie's Thrift Shop on Erskine Avenue in Peterborough will be accepting clothing and other small item donations. Staff will be wearing PPE and will not have any contact with those looking to drop off donations, so you'll be directed to remove anything you bring from your vehicle on your own. The drop-off hours, Monday to Friday, 11 a.m. to 1 p.m. That's the show for today. For Your TV, I'm Dan Malta, and we'll see you tomorrow.